Okay, my lead paper to be presented is coined Upscaling Budgetary Allocation for Effective Healthcare Delivery in Nigeria. And the coinage of this topic stands from the fact that to effectively deliver healthcare, you need a sizable amount of healthcare funding that will come from the budgetary allocation. Health is being recognized as a key aspect of human and economic development. And this is because at the level of human capital development, two important components are being altered in order to improve the development and capacity of human beings. And these are the health and the skill of people, which is part of the education expenditure. Of course, health in Nigeria is mainly financed through government budgetary allocation and other sources from donor funding, as well as the NHIS and the private funding as well. And the Nigerian 1999 Constitution empowers all the three tiers of government, that is the federal, state, and local government, to deploy resources to provide healthcare in their own jurisdiction. And therefore, healthcare is administered through these tiers of government. Of course, they are categorized into primary, secondary, and tertiary healthcare. While the primary is run by the local government, the secondary is run by the state, and of course, the tertiary is run by the federal government as well. Now we move to the overview of Nigerian healthcare system so that we see it from the background. While the federal government is responsible for providing policy guidance, planning, and technical assistance, it also involved in national health policy and establishing health management and information system. The federal government also is responsible for disease surveillance, drug regulation, vaccine management, and training of health professionals. The federal government is responsible too for the management of teaching, psychiatric, and orthopedic hospitals, and also runs some medical centers. As for the state government, it operates facilities like general hospitals and in some cases tertiary hospitals, as well as some primary healthcare facilities. It also undertakes the training of nurses, midwives, health technicians, and of course a provision of technical assistance to local government and programs, as well as it facilitates other programs that falls within the state authority. The local government oversees the operation of primary healthcare facilities within their geographic areas, which include basic health services, community hygiene, as well as sanitation. It is important at this point to understand the characteristics of the Nigerian healthcare system so that we try to link it up with the existing budgetary allocation and hence the need for upscaling, improving the allocation for effective healthcare delivery. Mukhtar in 2022 identified the following characteristics, which include inadequacy of public health system, increasing private sector health, presence of traditional and spiritual healers in the system, overcrowded health centers or facilities, long waiting times, stock out of essential drugs, and client dissatisfaction in terms of healthcare delivery and services, which means that the patients, the clients, are dissatisfied with the services ranging from consultation, drug administration, laboratory services, inpatient services, as well as other services that are embodied into the health care system service. Hussein in 2011 characterized the Nigerian healthcare system based on orientation and services it offered. And he argued that the healthcare system is predominantly urban-oriented, which means most of the facilities are skewed in urban areas. And the system is mostly focused on curative rather than preventive or rehabilitative services has been enshrined in primary health care, so that prevention as well as rehabilitative will help in reducing the number of cases that requires curative services. It is only accessible mainly to small part of the population, and finally health services are not organized to meet the needs of the entire population, but merely selected groups, since there is skewness in the distribution, since there is maldistribution of the resources, and since the location and localization of the healthcare facilities is being concentrated in urban and peri-urban areas. Other features that characterize the Nigerian healthcare system includes poor laboratory facilities and chemicals, which is also a product of inadequacy of funding and budgetary allocation, inadequacy of physicians, nurses, supporting staff, and other resources, inadequacy of logistic management skills, which led to frequent stock out of drugs and consumables, poor emergency preparedness and management, and of course incessant strikes and workers turnover because of lack of funding. All this issue of parity, all this issue of call allowances, all this issue of CONHES and the like are a product of poor budgetary allocation, a product of poor finance. If the finance can be improved, most of these problems could be alleviated so that the system could perform as it is expected. Now, I will quickly touch on the healthcare financing situation in Nigeria to be able to see the reality on ground. Healthcare financing revenue is mainly obtained from the pooled and unpooled sources. And of course, these pooled sources are raised from direct and indirect taxation, budgetary allocation, and donor funding. But the sad reality is that as Nigeria is becoming an emerging economy, the donor funding is being reduced. And with COVID-19 and other emerging diseases, even the donors are in a state of fatigue. They're trying to take care of the problem in their respective countries, and that is why the funding they extend to other countries is drying up, so much so that countries like Nigeria are being exposed and become vulnerable to these irregular flows of the funding. Of course, the unpooled sources include the out-of-pocket payments or expenditure in form of medical products and services. And these out-of-pocket payments constitute over 70% of the total expenditure. And in a country or a situation whereby out-of-pocket expenditure occupies a significant percentage of the funding, then the healthcare system is vulnerable, because health is supposed to be public in nature, to be publicly treated. I give example. How can eradication of disease be privately funded? Who will be ready to fund it in order to get his return? These public goods or public bads are better to be approached from public policy point of view. And that is why public funding of healthcare is much, much better than private funding or out-of-pocket funding. And this extreme reliance on out-of-pocket creates a significant barrier to health services, because individuals can no longer privately afford health care as they are supposed to, and where they can afford, they compromise other important sectors or other important expenditure like feeding, like clothing, shelter, education, which makes them to become vulnerable. And of course, over the years, healthcare financing in Nigeria has been described as inadequate, with budgetary allocation to health barely exceeding 7% of the nation's budget. And this allocation clearly falls below the 2001 Abuja Declaration of allocating a minimum of 15% of the national budget. At the same time, the WHO in its wisdom argued that 13% of the nation's budget can be allocated in order to overhaul the healthcare system. And of course, the Nigerian allocation falls short of even the WHO spending, which shows the sad reality, the sorry state of the Nigerian healthcare system. we look at the trend of the Federal Ministry of Health budget, and I will consider year 2000 to date. This is because year 2000 to date marked a significant era in the democratic regime, and of course the polity or the political system is fairly stable with no military interruption, and of course with a smooth transition to democratic rule. So data from the Federal Office of the Budget shows that allocation to Federal Ministry of Health has not improved over the years. 3.64% of total budget was allocated in the year 2000, and it improved to 5.9% in 2012, which has so far been the highest. And subsequently, it keeps improving. It rose again in 2017 and keep rising up to 2023, but yet to reach the 13% WHO benchmark or the 15% Abuja Declaration benchmark. A quick look at the budgetary allocation shows that from year 2000 to 2023, the allocation looks expanding, looks growing, but then if it is being analyzed from economic point of view and taking other important indicators, then it is nothing to take home. While there has been increase in the value of allocation, the population growth is estimated to be 3% annually, which means while the expenditure or allocation is going up, of course the population that needs healthcare delivery are also going up. There is also depreciation in the value of Nigeria's currency, which means the value of money is going down vis-a-vis what it can buy. And the budgetary allocation, unfortunately, is not growing in the same proportion or pace with the population increase and the naira depreciation, which means on paper or in nominal terms, the budgetary allocation may be increasing, but in reality, it cannot be used to sustain effective healthcare delivery given the rising population, at the same time given the depreciation in terms of naira vis-a-vis the foreign currency. And if budgetary allocation is viewed from naira depreciation, then it is worst off over the years, which means it cannot be able to satisfy the system. And if the population growth is considered, then the budgetary allocation over the years and the health system are overstretched and inadequate to meet the health needs of the teeming or growing population of Nigeria. I quickly discuss the consequences of inadequate budgetary allocation on healthcare delivery, which involve creation of a major gap in the financial resources required to drive the health system, because the financial resources are being derived from the allocation. And when the allocation is inadequate, then a gap exists. And the consequence is also reflected in the high health outcomes or indices, high maternal mortality, for example, about 512 maternal mortalities per 100,000 births, and child morbidity ratio. This is according to World Bank indicators of 2022. And according to Nigeria's health minister, the cases of maternal mortality can be attributed to not being able to reach the hospital and the poor state of the hospitals as well. And of course, the poor state of the hospitals can be attributed to inadequate funding. Nigeria accounts for over 34% of global maternal death, while the lifetime risk of dying during pregnancy, childbirth, postpartum, or after an abortion for a Nigerian woman is 1 in 22. If this is compared to the developed world, that indices is 1 in 4,900, which means you can see the poor health outcome or indices in terms of Nigeria, which is a product of poor budgetary allocation. Other consequences include inadequate and poor hospital and medical facilities, shortage of manpower while medical facilities are obsolete, lost in productivity due to high morbidity and mortality rates, Because if there is high morbidity, which means a lot of people could not access effective health care, then there will be a loss in their productivity, loss in man hours, loss in efficiency, and loss in their contribution toward protection policies. And of course, that will translate into loss of output, loss of money, and loss of development potentials at the level of the country. High out-of-pocket spending will breed poverty, diseases, death, and of course, other catastrophic issues. Low progress in universal health coverage, because there is no way how you can achieve universal health coverage without adequate funding. Declining of life expectancy rate, low immunization coverage, because the coverage as at now is only about 34%, and the inability of the country to eradicate some diseases like polio, which has already been eliminated and kicked off by other countries. And finally, poor access to primary health care and its components. Of course, the component of primary health care, like water and sanitation, like health education, like improvement in nutrition, like essential drugs, cannot be able to be achieved if the budgetary allocations are not enough. At this point, I think it is only fair to dwell on the recommendation or the way forward. We've seen the sorry state of the healthcare delivery in Nigeria. We've seen the dwindling and of course unequal and inadequate budgetary allocation and funding from the government. We've seen the dominance of the private out-of-pocket expenses. We've seen the consequences of all this saga to the poor state of health outcome. It is only fair if ways are recommended to curb these menace. The first recommendation is that the federal government should, as a matter of urgency, strive to increase the health budget to either the WHO benchmark of 13% or the 15% as recommended by Abuja Declaration, so as to guarantee effective healthcare delivery to its citizens. That is the first stage. If the budgetary allocations are not being improved, in fact, there is no miracle, there is no way how effective healthcare delivery can be achieved. Because it has to be effective in the sense that all the facilities have to be provided, all the procedures have to be observed, all the ethical as well as the global best practices have to be adhered to. There is also the need for adequate and timely release of funds by the government to the health sector for the funds to be effective. Another recommendation is reorientation of Nigerian health system toward primary health care at the foundation of universal health coverage, because primary health care has the ability to implement preventive and even rehabilitative care, so that the curative aspect of it will reduce. The identification of supplementary sources of funding through healthcare submits and other avenues are very important. It has happened in Kano State in the year 2022 when a primary healthcare submit was done, and of course it was proved that investment in primary healthcare is worth doing, and a lot of resources were gathered, and that helped to improve the budgetary allocation and hence improvement in the delivery. Prevention of leakages is very important. According to WHO, about 40% of healthcare funding is being leaked. Therefore, improving the budgetary allocation alone may not solve the problem unless leakages are being prevented. If leakages are being prevented, the meager allocation can be able to be utilized. Attached to this is the application of evidence-based decision-making, as well as the need for implementation of what we call economic evaluation of health care intervention projects and programs by healthcare managers, so that cost minimization analysis, cost effectiveness analysis, cost utility, cost benefit, cost consequences, and other healthcare modeling techniques from purely economic point of view could be done in order to utilize the little and limited resources and allocation we have, so that we see the best value of money. And I concluded my discussion by saying that the role of healthcare budgetary allocation is to help acquire and deliver healthcare to the teeming populace. Therefore, upscaling the allocation is crucial in effective delivery of healthcare at all costs. Nigerian government need to increase healthcare budget allocation to bridge the finance gap with a view to achieve access to healthcare and hence the universal health coverage. Effective utilization of budgetary allocation to reduce unnecessary wastages as well as prioritization of primary healthcare are intended and of course are considered to be important factors in promoting delivery of healthcare to the citizens. I thank you most sincerely for giving me the chance to make my presentation, and I hope this will be the yet beginning of another relationship between Adeleke University and the African Institute of Public Health Professionals, as well as Bayero University at large. Thank you very much.